Ever wondered how gut health affects your skin? Well, the Gut Skin Access reveals that a healthy gut microbiome is crucial for a radiant skin. This video explores the crucial role of the gut microbiome in maintaining skin health. Now, before we dive in, you're watching The Daily Dose with me, Dr. Mitch. This is a Hue Light web series, and if you like our content, please subscribe and hit that button. When we release new content, you'll know too. Make sure you stay with me until the very end. I'll give you my secret tip of the day, and you won't hear this anywhere else. The National Library of Medicine published an article in 2021 titled Gut Skin Access, Current Knowledge of the Interrelationship Between Microbial Dysbiosis and Skin Condition. First, let's start by talking about what dysbiosis is. Under good conditions, there are over 500 species of bacteria and fungus and other alien elements that live in our gut, but they live in a synergistic relationship. And many of you have heard of the good bacteria called the probiotics. And then there are bacteria that could overgrow if there were not enough of these, maybe because you took antibiotics or something of this nature, which is really a story for another video. But now we want to see how that upset could cause any problems anywhere else in the body. Now, some theories explain that depending on how the microbiome is composed, different type of fighter cells, white blood cells called T cells, will be activated. While others might say that some bacteria can pre-activate these T cells that mimic ocular or eye structures. And intestinal permeability, meaning that if the intestine doesn't keep the bacteria within the borders of the intestine, and some get leaky, meaning that you get leaky gut syndrome, and this bacteria can get into the bloodstream or the metabolites into the circulation, there could be a problem. In addition, therapies like probiotics diet, fecal microbiota transplantation have been shown in favor to balance the microorganisms that limit inflammation, in turn generate beneficial effect of different areas, including the skin. The gut-skin connection is your gut microbiome bustling with ecosystem of bacteria, viruses, fungi, and other microorganisms in your digestive tract, which holds the secret to your overall health, including the condition of the skin. But a new article has also shown these changes in the T cells can affect the eye as well. Yep. Even age-related macular diseases, diabetic neuropathy of the eye, glaucoma, and other inflammatory diseases of the eye may be related to the gut microbiota, which may not be healthy. So you can imagine how the gut can actually cause disease of the eye as well. Well, it can affect the neurologic health too. Parkinson's, Alzheimer's may also have not only ocular implications, but also neurologic implications with the bacteria not being in check. Dysbiosis leads to systemic inflammation. It's a risk factor for tons of conditions, including heart and even a metabolic syndrome, which is diabetes and aging. Here's the connection. Inflammation. The inflammation doesn't stay confined to the gut. It travels through the body and ignites your skin and causes acne, eczema, and psoriasis. Yes, all through the gut. But let's make this clear now. Let's summarize all the information about the gut microbiome and then give a hint of what you should be thinking. The gut microbiome plays a crucial role in the development and function of the immune system. We know that babies that are vaginally delivered usually have a much healthier system in general than those who are born by C-section, because as they are born through the vaginal system, they get to initiate their gut microbiome through the vaginal secretions of the mom. An unhealthy gut can lead to risk of infections, autoimmune diseases, and allergies, as the literature shows us. Imbalances have been linked to obesity, type 2 diabetes, the metabolic syndrome due to the influence of metabolism and energy extraction from food, known as the gut-brain axis, and it does influence mental health as well. Dysbiosis has also been associated with anxiety, depression, neurologic diseases, and the higher risk of arteriosclerosis, heart disease, and high blood pressure has also been shown. Dysbiosis can also contribute to that fatty liver and liver scarring that we hear so much about as well. The gut microbiome influences absorption of our nutrients. It's critical for bone density. It's including calcium and magnesium absorption, and it potentially impacts our osteoporosis risk. Let me give you your key takeaway. This is what you need to know. You could just take probiotics and think that all these things will be in check. No eye problems, skin problems, etc. will help. But let me tell you, that's not good enough, because you don't know which probiotic to take. If you go on the shelf or you look around, some have 14 billion units, 100 billion units. How much is better? Is more better? Is less better? That's not the way to do it. So the hint here is get a CDSA from a functional doctor. CDSA stands for Complete Digestive Stool Analysis. What that's going to tell you, other than inflammation and whether you have good absorption, one of the main things that comes from that CDSA is if you have any dysbiosis and if you have sufficient quantities of the probiotics. How would you know how much to take without having that information? You don't. And that's my key takeaway for today. This is the Daily Dose. I'm Dr. Mitch. For more information, you can always visit our website at huelightusa.com. That's HUELIGHT USA.com. Thank you so much for watching.